My name is Kevin Blumenthal. I'm a urologist just down the hall at Central Maryland Urology. I don't know if some of you look familiar, you may be part of the group as well. But the name of my talk today is going to be what you need to know to have a super prostate. A little bit different title. I took the liberty to change it a little bit, but in any event, just some housekeeping notes for those of you who may not have been here before. There's a questionnaire in the back. If you could sign that, it helps me out. I actually do look at them. The outlines that I gave you was a recommendation from my last talk I gave, so I do actually use them and incorporate some of the suggestions. The outline is there as well, so feel free, those are yours to take home with you. You can take notes on it. And then the last thing up there is the sign-in sheet. Feel free, you don't have to sign in, but if you want to sign in and we can put your name on sort of our newsletter, our email newsletter, write your email legibly so we can actually read it. And periodically we send emails out to let you know if there's any upcoming talks and that sort of stuff. Okay, so good.
To give us an evaluation, do you want?
That is not, that may be through the Wellness Center.
You would like yours?
If you don't have to do it, but I appreciate it if you get some feedback from me. I don't get those. I may get it eventually, but the other ones I just made myself, so I'll collect those at the end. So that's sort of the housekeeping bit. Again, I want to make this as interactive as possible. I do not want to hear myself talk for an hour, so feel free to just yell questions, raise your hand, that sort of stuff. Okay. This is sort of a super speed highway through the prostate, all that is prostate. So we're going to kind of hit the highlights. First, we're going to talk about some background information about the prostate, go over BPH, or benign prostatic hypertrophy, and then at the end we'll do cancer. The second half will be about cancer. If you have any questions or anything, shout it out. Does anyone know what the prostate does, why we have it? It causes lots of problems, lots of anxiety, but God made it for a reason. Does anyone have any ideas of sort of what it does, why it's beneficial, why do we have it? What's that?
It protects the semen.
Excellent. First, right off the bat, there you go. Good answer. So it's actually, it protects the semen, it protects the sperm. It's actually, the word is actually Greek for one who stands before a protector or guardian. It provides the fluid that actually liquefies the semen, protects it, gives it the energy and the nourishment that it needs throughout its travels. During ejaculation, the prostate actually squeezes and contracts and ejects the semen as well as this fluid into the urethra. And the sperm plus this prostatic fluid, along with some other fluid as well, that's actually what creates the semen. Okay. The normal size is 20 grams. It's sort of hard to conceptualize what it is. Does anyone sort of know? We use some food products to sort of say this is what it's similar to. Does anyone know what we use?
Walnut.
Walnut, exactly. Yeah, we use a walnut. So if you think of a walnut, that's about the size that it should be. The normal size, I should say. As men age, a couple things happen with the prostate. It gets bigger. Okay, so the lumen of the stroma of the prostate, the tissue within the prostate increases. The amount of that tissue increases. As that increases, that has the potential to obstruct the outflow of urine. In addition, number two, there's also an increase in the alpha receptors within the prostate. What that does is that creates the increase of receptors increases the contraction in the strength within the prostate as well as the bladder neck. So in effect as well, it has the potential to decrease the flow of urine through the prostate or from the bladder. And that's actually the most common cause of symptoms, the common reason of symptoms.
What do you mean it increases the contraction? I mean, does it
increases the tone, I should say. Increases the tone of the prostate. So if you think of your bicep, if your bicep is extended, it's nice and soft. If you contract it, it's tense and firm. The same way, the more alpha receptors you have, the more tense it is, the more firm it is. Meaning that therefore the urethra that runs right through it can become obstructed.
Okay, so it's like it's partially contracted all the time?
You can think of it that way.
Okay.
Yeah.
Is it like dried out? Not much water involved?
No, it's actually very vascular. The prostate is one of the more vascular organs of your prostate, so it is very fluid-filled and vascular-filled. It's not really dry.
Did you have other disease or disorders with that affected?
Affected.
You know, the size or causing it to.
The enlargement,
Yeah.
prostate cancer can, absolutely. Yeah, yeah. There are some, how do we combat these two things? Medications is one reason, and we'll go over this, but just to sort of introduce the topic, 5-alpha reductase inhibitors actually decrease the size of the prostate by decreasing decreasing the amount of stromal tissue. Okay, so that sort of cancels out the first problem. And then we have alpha blockers, which cancel out the second one. It blocks those receptors, so it sort of cancels out the tone. Okay, and we'll go over this again, but I just sort of wanted to introduce the topic. The score, the card on the right, that may look familiar to you. We give that to you oftentimes when you come in, ad nauseum, every single time you come in, maybe too often. That it sort of gives us an idea of what's going on, how much your symptoms are bothering you, what type of symptoms you're having. Oftentimes symptoms are broken up into a voiding problem or a storage problem. A voiding problem can be poor flow, poor emptying, hesitancy, dribbling after you urinate, versus a storage problem is urgency, frequency, waking up at night, that's the nocturia, waking up at night having to urinate. We used to think that was the whole story, that was it. You have these symptoms, it's due to the prostate. That's not the whole story, at least that's what we're learning. When women come in, when they have symptoms of frequency, urgency, we blame the bladder. When men come in, we blame the prostate. It's not always that simple, and we're finding out that men can also have problems with the bladder. And the reason this happens is, as the prostate gets larger, the bladder compensates by it needs to work extra hard to get all that urine out. It works extra hard. It can do that for a period of time, but over a long period of time, it can get tired, it can get very muscular, and because of that, it changes some of the dynamics of the bladder, and it can become hyperactive. Okay, and what we call overactive bladder or hyperactive bladder. And that can cause some of the symptoms as well. And lo and behold, we actually have medications to help with that too. Okay, and again, we'll go into that a little bit. All right, so the natural history of enlargement of the prostate. It's a progressive non-cancerous, and that's the important part. It's a non-cancerous enlargement with age. And so you have your walnut, and it just gets bigger and bigger and bigger and bigger. Okay.
Do you know why that is? What it is in our body?
Testosterone, mostly. That's the key component. And what happens, and we'll go into it with the medications, but basically testosterone converts to dihydrotestosterone. And the prostate likes that much better than testosterone. There's an enzyme that creates that conversion. The 5-alpha reductase inhibitors, Proscar and Avodart, those two medications block that conversion. Okay, so it actually decreases that size. Okay, it's sort of the fuel that feeds the growth of the prostate, blocks that fuel.
And can that reverse some of the growth in the prostate?
Not really reverse, but we have well, I take it back. It can shrink it. I take that back. It can reverse it, and it does shrink it to a certain point. But then we also have surgeries that can do even more. The old rotor-rooter to clean out the prostate. And there's some newer things that we'll talk about a little later. So there are several autopsy studies that were performed to look at the percentage of growth of the prostate, percentage of enlargement of the prostate as men get older. And we found that BPH increases with age. Sort of know that now, but it wasn't self-explanatory back then. It starts around age 40, and if you think about it, however old you are, that's the percentage of likelihood of BPH. So gentlemen in their 60s will have a 60% chance of having enlargement of the prostate. 70s a 70% chance, 80s 80% chance. If you live long enough, you're going to get enlargement of the prostate.